So ankle sprains are a very common injury that occur. Anybody that's been active throughout their life has probably sprained their ankle, and it involves rolling the ankle so the foot kind of turns underneath and you end up damaging the ligaments on the outside of the ankle, or what we call the lateral side of the ankle. And there's basically kind of three grades of sprain: 1, 2, and 3. There's really no way of defining what grade of injury you have if you've rolled your ankle. We basically kind of guide and tailor treatment based upon the amount of swelling and discomfort, but it can be very problematic. Another common question is, how long does it take a sprain to heal? The generic answer for any soft tissue injury is about 12 weeks. But the goal of treating an ankle sprain is to try and calm down the inflammation, maintain your motion, decrease your swelling, and then get you rehabbed to try and prevent it from evolving into something called chronic lateral ankle instability. The ankle sprain itself will almost never require surgery unless there's some kind of associated injury that's more significant. But if not treated appropriately, or patients sustain multiple ankle sprains over the years, it can develop into what we call chronic lateral ankle instability, where the ligaments are kind of stretched out like an old rubber band, and it can cause chronic pain and swelling on the outside of the ankle. It can affect the tendons that run behind the bone on the outside of the ankle, and it can actually progress to ankle arthritis if left untreated. And the analogy I like is a tire on a car. If the tire is not balanced, the tread will wear out unevenly and cause the tire to wear out faster, and it's no different in a human joint. So ankle instability is a very common condition that I see in my practice. Patients almost universally have been active at some point in their life, have sustained at least one or more ankle sprains, and they don't even have to be severe. It can be cumulative over time. And so what happens then is the ligaments are stretched out. They can't provide the stability to the joint that is required for normal function. And it's like having an unbalanced tire on the car that will wear out unevenly or asymmetrically if not balanced and aligned appropriately. If patients present with symptoms consistent with ankle instability, we typically are looking for certain things on physical exam and imaging to make sure it's not something more significant. And then we would talk about bracing to try to provide some external support to those ligaments that are not functioning internally. And assuming patients respond well to that, we can progress to physical therapy to try and work on strengthening the muscles around the ankle to basically pick up the slack for the ligaments that are stretched out and not functioning optimally. And then long term, if patients fail all of those conservative options, we would then start talking about surgery to basically try to balance the tire on the car and protect the joint for as long as possible.